We're visiting today with Dr. John Thomson, Dean of the Iowa State University College of Veterinary Medicine. This, I believe, is the first public College of Veterinary Medicine established in the United States, I think in 1879.
Correct.
So thank you, Dean, for visiting with us today.
Yeah.
This is a course in public health informatics, which we've defined and our author defines basically as use of information technology in the practice, teaching, and research of public health. So I'd appreciate your responding to some questions I might have about that topic of public health informatics. Now we're standing in front of a sculpture by Christian Petersen, who, as I understand, was the sculptor at Iowa State University and prepared this piece, Gentle Doctor, and a mural behind it. I wonder if you'd describe a bit about the Gentle Doctor and the mural.
Yeah, well, the Gentle Doctor was developed back in 1938. Christian Petersen, as stated, was an artist in resident, and he was housed in the College of Veterinary Medicine. And in fact, a lot of the students at the time would watch him do the sculpturing, and he really understood veterinary medicine. And when he developed the Gentle Doctor, he caught the compassion of the animal-human bond. And what was really so unique about him capturing this is the fact that this was the first companion animal veterinary practice was developed in Iowa, or formed in Iowa in the 1950s. So some 15 years prior to the first companion animal practice, he already had established the bond, the animal-human bond, and the compassion of veterinarians for animal well-being. And then the second piece that Christian Petersen developed was the bas-relief that's directly behind the Gentle Doctor. And this is what, from a course in public health and everything else, I think has a real message for your class. And if I could, I'll just kind of go through the bas-relief for you. The Christian Petersen, what he wanted to do was he wanted this bas-relief to remind the faculty of the college and the students on what the curriculum was supposed to be developing them to do. The other message that he wanted to bring across to them was the fact that animals need humans for their well-being, and humans need animals for their well-being. And so this is really the One Health message. It's one health, one world. And the people are inspecting the cows over. Can I walk over here? Okay. The people here that are inspecting the cows, they're looking for the foot and mouth disease is what they're checking the cow for. And there's some public health significance of that, and also just the well-being of the health of the cattle population and the national cattle population. I always thought when I walked by this so many times that they were doing surgery on this calf, that these people were restraining this calf and doing surgery. But then I come to find out it's a smallpox vaccination, and they're developing a smallpox vaccine for humans. This, I always thought it was pretty neat because the people were restraining the horse, and it showed the real strength and everything in that, but that really isn't what this is about. They're drawing blood from this horse to get serum, and they're going to use it for diphtheria and tetanus antitoxin development for humans and animals. And so again, animals need humans and humans need animals. We'll step over here. I'll step over on this other side now, and I know the camera will have to follow over here a little bit. But this is the classical vaccination of the animals for production of classical swine fever or hog cholera. It killed a lot of swine and everything. So the vaccine was developed. So the animals needed humans. They needed humans to help protect them from that. Also for the producers to be able to provide the food for human consumption. The individuals here that are working on this dog, they're getting inoculum from the spinal cord of this dog. The dog is a rabid dog, and they're getting the inoculum there, and what they're going to do is inject that into sheep and into rabbits, and for vaccine for humans and for animals, for the rabies. And of course, the last person here is a diagnostician, and this diagnostician is examining, in this case, for a positive or negative rabies sample, but it could be for anything. But I think this is a powerful, powerful piece of art that speaks to the one health and the one medicine on what you people are studying in your public health.
Thank you. On the plaque, it also notes conserving the life and health of animals and thereby safeguarding the health of humans. In the public health context, can you describe maybe the food? There are other references on your website, for example, that you're protecting the food supply as well as animal and human health. Can you describe common roles, operationalized, if you will, veterinary medicine in public health?
Well, yeah. I mean, it's. I think one of the statements we've said, you know, whether it's the food we eat or the air we breathe or the water we swim in or drink or whatever, veterinary medicine in one way or another, the animal interaction, it impacts you in every way. I just met with a group of veterinarians from Macedonia that were visiting the college, and they're very excited. I was over there in the 90s working on a brucellosis eradication program, and their country is going to, they think, going to attain negative status now, and they were really excited about that. And brucellosis is a good example of one of the zoonotic diseases that the United States has managed to eliminate, but much of the world still suffers from, and it's a perfect public health pathogen that we have worked with for many years. But you know, I think in almost every aspect, you know, like I said, not just in food safety, it's the interaction, whether it's a companion animal or whether it's is a food supply animal. We have all different types of pathogens. Whether it doesn't have to be, it can be your simple parasite management and that type of thing. So I'm sure everybody in the class understands that.
Not everybody. Part of the class is composed of graduate students in epidemiology, and ironically, a question was asked by one of our epi or other non-veterinary students: what is the role of veterinarians in public health practice? And I think you've helped us out.
Well, you know, as far as a general practitioner, I was a general practitioner for 20 years in a small community, rural community, and there were 3 of us veterinarians that served on the county public health board. We were the only ones serving. We had one human physician that came in periodically to sign papers, but really it was those 3 veterinarians that managed the public health, developed, hired the first public health nurse for the county, set up the home health aides. We set up a lot of the home health support groups and this type of thing. And so you know, when you're working on a livestock unit, you're working with the people and the livestock because they are one. And so the food animal veterinarian really it practices public health every time they go out, because they're working with humans and animals and in an environment, and how many times we had, either if it was some type of a person that was going through cancer treatment, or maybe a mother that was pregnant expecting a child, you have all these considerations when you're making diagnosis of whatever it is. We may have cryptosporidia, salmonellosis, all these different things, pathogens that we have to consistently think about the human health along with the animal health.
Right. I served on an institutional review board with Russ Currier. Dr. Currier was a veterinary medical doctor, a veterinarian, I'm sorry, I struggle with my words, with the Iowa Department of Public Health. It must have been for more than 30 years.
Yeah.
What would his role be in the Department of Public Health? And we might have an opportunity to visit with Dr. Currier, but...
Yeah, well, I mean, they you know, understanding, number one, the interactions of animals and the disease within that animal population, and the zoonotic significance of it, and being that voice and knowledge base, to bring to the discussion, because if you don't understand animal populations and animal management, you cannot have the full picture of how you're going to prevent the human health significance of that.
Right. In human medicine, there are registries. There are several heart registries that I'll work with in healthcare and hospital and clinical care. But there are also repositories of data, like with the hygienic laboratory at the University of Iowa. I believe you have a similar laboratory with voluntary or mandatory reporting of zoonotic disease.
Absolutely.
Can you describe that?
Yeah, I've been a laboratory director for 10 years, and then I have been over laboratories in Mississippi, South Dakota, and Iowa, and it is the data collection point for emerging diseases within the animal populations. And so, yeah, we do have specific diseases, that pathogens that we have to report, but also it's where the emerging, that is the front line of diagnosing and identifying the emerging diseases that we have, and of course of zoonotic significance too. And one of the things I did as a laboratory director was I picked certain pathogens, zoonotic pathogens, and I would track those with going back to the farm of origin of wherever that diagnosis was made, and if there was human involvement, then we'd go out and do a on-site visit to see what the interaction was and the outcome and where we could have been prevented. Many times I found that the human health provider and the animal health provider did not talk, and there was a breakdown of communication there. Great suffering occurred because of that. Children became uninsurable. People had to take bankruptcy because of health problems that were created. People had to quit work and sell the farms and this type of thing because our health professions weren't communicating. And over some things as simple as Salmonella typhimurium type B or things like that.
You bet. You bet. So, by way of technology and topics in this class, in the last 2 weeks we've been studying disease surveillance, where in some data systems one might monitor the incidence of disease or vaguely defined syndromes and look for a spike in the incidence over time. Do you have similar surveillance systems for zoonotics?
Do. Yeah, we sure. Well, I guess for zoonotics, I would say yes. We do our annual reports and we do mapping and this type of thing. We follow influenza patterns, whether it's avian influenza. We follow those. We follow other patterns, and so we can show you hot zones. Where they've been coming from and how they're expanding and how we might be able. In fact, even in some animal populations, what we do is we have filter systems for their air filters for their buildings, and when we know that there's a high incidence of certain pathogens in that area, why we kick the filtering up and filter all the air and everything else to prevent those diseases. So yes, we do that type of monitoring.
Absolutely. We have students in Iowa, and as you know, in around the world. Some are participating from Singapore and Puerto Rico last semester. Do you have any areas that you might offer or your faculty might be interested in collaborating with our students? They'll have a project for this semester, but many are interested, I think, in careers in public health, sometimes from a veterinarian's perspective, sometimes from an epidemiology or other health sciences perspective. Any thoughts on collaborating with students or young professionals in this field?
Oh yeah, I have a niece that is a PhD epidemiologist, and we talk fairly regularly about different things, projects that they're overlapping. So yes, we have all types of opportunities to collaborate. And for our diagnostic thing, we have our microbiology department. Our college has built an international reputation on really the pathogenesis of disease, and so our pathology department is one of the top pathology departments in the world. Our microbiology department, again, is strongly represented by outstanding scientists, and there's sort of a lot of opportunity to work with zoonotic disease and pathogenesis and this type of thing from our college.
Excellent, excellent. Well, thank you for taking time.
Well, it's one medicine, and informatics is the only way that we're going to be able to map the progress that we're making or identify the problems out there. And I'm convinced that quality medicine is going to be outcomes-based medicine, and to have outcomes, we have to have the data. We have to know what's out there. We have to know what interventions have been taken place, and then we have to know what the outcomes of that intervention has been for us to continuously improve our public health or society's health. So I appreciate the opportunity to visit with the class and visit with you.
Excellent. Thank you, sir.
You bet. Okay. Thank you.